And can we talk about the Vampire Facelift, Dr. Marc? I mean, how does that work?
So this was invented by Dr. Charles Runnels, who we really think is a visionary. And he really captured the idea of regenerative medicine and using platelet-rich plasma from the patient's own bloodstream to be re-injected into being able to be used in cosmetic ways. So what you do is you draw the person's blood, we spin it down in a centrifuge, it separates the red cells from the plasma. That has a high concentration of platelets in it. And when that gets injected, it calls forth about 7 different types of growth factors into the area of injection. We use a special, more advanced type of platelet-rich plasma called platelet-rich fibrin matrix, PRFM, or cell-fill, which has a little protein grid that holds those growth factors in the area that you put them for a longer time. It also calls in your own stem cells, your multipotent stem cells, that then can start to make your own collagen, your own new fat cells in that area, and also start to grow microcapillaries, little tiny blood vessels in your skin, which after about a month, you start to see a rosy glow of youth. Now what Dr. Runnels did is he combined using platelet-rich plasma with a small amount of hyaluronic acid filler in a pattern that was described by Leonardo da Vinci's mathematical drawings of beauty. So we just love this procedure. It's a very beautiful and natural result. As you can see, Kathy, we're all set up and we would love to show you a demonstration. We brought a beautiful model, Karen, with us, and she's going to come over.
Great, wonderful. Hi, Karen.
Hi.
How are you?
Excited.
Yeah, me too.
Let's get you right in the chair. Karen's been numbing for a while, and
So what is this, Dr. Marc?
We have drawn her blood, spun it down in the centrifuge, and now we have this separated from the red blood cells and the serum. This is what we call the liquid gold. So now I'm going to activate it with calcium, but before I do that, I'm going to be doing the 1 syringe of filler. Then I'll activate the platelet-rich plasma and inject that. So it's a 2-part procedure, and the combination is just beautiful. So now what I'm going to do, Kathy, is just draw a little bit on her face to mark some of the landmarks that we want. So everybody has a different technique on how they mark the face, but I like to do it from the ear down to the nose, and then I mark at the suture line, at the most prominent part of the cheekbone. And then there's always like a little pull that happens as the face starts to drop down. It's like a break in the fat pad that you get. So I mark that because I want to puff up that break in the fat pad.
And that's really unique to each patient as well.
Now, part of this Da Vinci thing of the mathematical drawings of beauty is when we're putting something underneath the eyebrow, she looks at me directly and I'm going from the tip of her nose and I'm looking at her iris and seeing exactly where I want to add something just underneath the brow.
So basically from the nose to the brow through the pupil.
Okay. And what effect will this give?
This is going to volumize a little bit, but the platelet-rich plasma takes time to activate in the system and develop collagen. Collagen takes about 90 days to be produced naturally. And so over the course of the next few months, in the next few days, she's probably going to really see a glow to her skin that she wasn't noticing. And our biggest source of referrals for this is our patients. Our patients will take Facebook pictures and their friends will call us and say, what did you do to so-and-so? And of course, we have to say, you'll have to ask her. But most often that's the Vampire Facelift.
Okay.
And just the little bit of filler changes, again, the way the light reflects. So Kathy may turn her face, and I don't know if you can notice, but you see how it's reflecting differently here. It's reflecting off the brow a little bit different. And the cheekbones as well. So think about where you would put highlighter on your face if you're putting makeup on. And you don't even have the PRP in it yet. So filler is instant. It's magical in my opinion. And it will.
That's incredible.
Yes. Do you want to come up here? Come up here and see. I want to show you up close.
Oh my goodness. You're gorgeous. Wow. Gorgeous. Just stunning. I mean, so natural.
Isn't it?
So, yes. Just beautiful.
Okay, so platelet-rich plasma underneath the eyes is very safe. filler underneath the eyes has some risks to it, but can be done safely. But platelet-rich plasma is very safe because it just came out of your own blood. And this is injected as a bolus because it just, meaning one glob, because it just spreads itself so easily.
She's going to be able to push it over the surface of the skin through the tissue under the eye.
Okay. Well, and it's amazing that it comes from your own body.
Isn't that great?
And so
putting
many
it
of our
right back.
patients that just they eat organic food, they want everything
Right,
natural, and they
yeah.
want something natural
Of course,
for
that only
regeneration
makes
of their
sense
youth as well.
Exactly.
And now I'm injecting the PRP, the cheek, the nasolabial folds, and the marionette lines, because
Karen,
that's where we want her own collagen to be building.
Well, Karen, I don't know how old you are. You look like a teenager.
Doesn't she?
Yeah, beautiful.
Well, I don't know if I want to go that far back.
Well,
I like my wisdom.
Yes.
you got it all.
But we can be wise and not have the wisdom lines.
That's right. That's right.
Let's take a look at the cheeks here. You know how full they look. And again, the liquid is going to dissipate a little bit, but in about a month, that's what that's going to look like. And in 90 days is when she's going to see the full results of that collagen
So it
production.
even gets better?
It gets
yes,
better over the
yes.
course of 90 days.
Wow.
And we really can't stress enough how Dr. Reynolds, who invented this process, he really, really is a visionary.
Well, I mean, your lips are beautiful.
Really?
I mean, just so beautiful
just
and
a
natural.
smidge
And I
left,
see the lifting.
Isn't
that
it
does.
amazing?
Yeah, so fast. So by doing these treatments, is it also preventative?
Absolutely.
I mean, is there a certain
Absolutely.
age that you recommend that?
Younger and younger women are doing it because they realize if they start building their own collagen early, they're not going to show the same rate of aging. So it's really
Right.
exciting, the
Yeah.
regenerative medicine movement.
And the preventative aspect of it is really important, I think.
You are finished, my
Wow,
dear.
and you don't have makeup on your
She
face.
doesn't.
Your skin, I mean, your face, it's glowing, beautiful. Wow.
Isn't it amazing? It's like
Incredible. Wow.
Thank you so much for being our
Yeah,
model
thank
today.
you. Thank you for coming.